Hey everybody, thanks for joining me today. Dr. Ross Marcogiani at Turnpaugh Health and Wellness Center with another great word of the week. Today's word of the week is going to be magnesium. So I have patients frequently come up to me and ask me, what's the best type of magnesium I should use? So I figured we'll dive in and talk about that and address what cases and what situations we would want to use magnesium. So we'll talk about what is magnesium, different types of magnesium, what is magnesium used for, and how we test your magnesium levels. So let's dive in. So what is magnesium? Magnesium, if you've tuned into my micronutrients talk, is a macro mineral, meaning that we need to get this, we need to get greater than 100 milligrams per day to have adequate amounts of magnesium. And we need to get this from our nutrition. This is something that we don't make in the body and that we need to take orally. Magnesium is involved with over 300 metabolic reactions, whether it be from protein synthesis and the help in making of amino acids, whether it be for the use of muscle contraction or relaxation, whether it's the use for genetic expression, helping to repair DNA and RNA, for neuronal health, the proper firing of neurons in nervous conduction. There's a lot of things that magnesium does. There's also a lot of research that shows that magnesium may help improve type 2 diabetes and cause more insulin sensitivity, helps with headaches and migraines, helps with osteoporosis, helps with heart health or cardiovascular disease. So magnesium is really, really important, and actually 2/3 of the Western world is deficient in magnesium. So even though we are harping on it, this is something we definitely want to make sure we're incorporating into our diet, into our nutrition. As we already spoke, it helps with increasing energy, nerve communication, blood pressure, muscle contraction, and so much more. Magnesium is typically attached to some type of amino acid, sugar, or ion, which we'll dive into in just a second, which will make more sense. So different types of magnesium. So usually we'll see the word magnesium, and then there'll be some other goofy word associated with it. That's either the protein, either the salt, the sugar, or an ion attached to that magnesium. You can see we have various forms of magnesium, such as magnesium citrate, magnesium oxide. Magnesium oxide is really helpful for heart health. We have magnesium chloride, which can help the muscles. And also it is used in milk of magnesia, so it can help the digestive tract. We have magnesium lactate, magnesium malate, magnesium taurate, which is helpful with nervous conduction. Okay. We have magnesium L-threonate, magnesium sulfate, magnesium glycinate, and magnesium orotate. That's another helpful aspect for heart health, is the magnesium orotate. But the three that I starred here that are the most common and that I use most readily are the mag citrate, mag malate, mag glycinate, and the mag L-threonate, which we'll talk about in just a moment. So these common magnesiums that I just mentioned, the magnesium glycinate and the malate are typically the most common magnesiums I would suggest using. Research has showed that that magnesium glycinate can help with sleep, it can help with inflammation, heart disease, diabetes, mood disorders, muscle spasms. So these are all conditions or aspects that has been researched to show a link in at least helping. Magnesium malate acts very similar to glycinate. Some researchers show that it may be able to help fibromyalgia, chronic fatigue syndrome, and the magnesium malate has less digestive issues compared to the magnesium citrate or citrate, however you want to pronounce it. The magnesium citrate, I'll typically use this if the person is constipated and we want to have more regular bowel movements. The magnesium citrate is really helpful for bowel function and acting like an osmotic and drawing more water into the lumen of the digestive tract. Then the other aspect that I use here is the magnesium L-threonate. This is really nice because this is the type of magnesium that's most readily absorbed by the brain and may help with depression, may help with memory loss. So this is something that I'll typically use if that's something that I'm seeing here, or just may want to support the brain with more magnesium. I'll support it with magnesium L-threonate. And then some testing here. So you can do a magnesium loading test. That's where you have you ingest a certain amount of magnesium, and then you do a 24-hour urine catch and see how much magnesium is absorbed or how much is excreted out. The best gold standard, what I would be doing is a micronutrient testing, because you get to look at intracellular and extracellular magnesium. So the magnesium that's in the cell and then the magnesium that's floating outside around the cell. We get to look at both of those and all the other micronutrients that go along with the magnesium testing. You could do serum magnesium testing, not as accurate. That's going to be looking at more of the magnesium that's in the extracellular space, so what's sitting around the red blood cell and not being taken in. And then you can also look at your red blood cell magnesium. That would be more preferred over the serum magnesium, because that's looking at what is actually absorbed into the cell. And then what we have here is our magnesium intake. So this is the recommended dietary allowance, the RDA. I remember one doctor that I came across is that, yeah, the RDA stands for really dumb advice. Take that with a grain of salt. The reason why he mentioned that, you can see here for males and females, 51 years and older, 420 milligrams per day for male, 320 milligrams per day for female. Sometimes we may need more than that, depending on how well we're digesting and absorbing the magnesium. You may need to bump that up a little bit more. Certain patients I'll titrate up till they have loose bowels and then back off. That's one strategy. But this gives you an idea on where you should be at for your age and the amount of milligrams you should be taking in for magnesium each day. But depending on what symptoms you're experiencing, depends on the certain type of magnesium that you'll take. And then just repeat this video back and go back to that section where I talk about the glycinate, malate, and the citrate and the L-threonate, to differentiate, what symptoms that you would like to support. Again, we're not treating anything, we're just helping to support the body. So I hope this video is helpful. If you have any questions or you want to get your magnesium tested, please don't hesitate to reach out to the office. Please share this video with anyone that you know can benefit from this. And thank you for your time and have a wonderful day.